Good afternoon, Mr. Presión Alta. My name is Lilith. I'm going to be the nursing student today, helping give you your medications. So far today, we have your Clonidine, also known as Catapress. It looks like you'll be getting 0.1 milligram twice a day. So this is your first dose of the day, and then we'll see how you do with it and possibly give you another dose later on. Clonidine is used for lowering your blood pressure. It can also be used for helping with withdrawals, which can theoretically raise your blood pressure as well. But today we're just focusing on your blood pressure. And then it can also potentially lower your heart rate that is getting a little bit higher, but right now it's mostly to focus on your blood pressure. Do you know if you have taken Clonidine before? You have? Okay. And then did you have any allergic reactions to it or like bad side effects while taking it? No? Awesome. That's really good as we have it prescribed, but we don't want to give it to you if you're allergic to it. So some of the things we're gonna keep an eye out for this medication is if your blood pressure gets too low, because it is supposed to help lower your blood pressure, but we just want to make sure it doesn't get too low. So we'll be checking your blood pressure every few hours and also checking your heart rate. And then we also want to make sure that before we give it to you right now, we're going to check your blood pressure and your heart rate, make sure that they're at a good level, that you still need this medication, and that it's not going to make you go too low. And then so with it being lower, like your blood pressure being lower, just make sure that we aren't like super dizzy when you're getting up, or if you're laying on your back and you feel like all of a sudden you're super lightheaded or dizzy, give us a call with your little remote, and we'll come check your blood pressure and make sure that it hasn't gotten too low or anything like that. And then in a few hours, we're gonna just keep checking your blood pressure to make sure that it goes well. We also want to make sure not to suddenly stop taking this. So if this medication ends up working really well for you and we're able to maintain your blood pressure where we want it, and then you end up taking it home with you, we want to make sure not to stop it abruptly. So just whatever is going to help you remember to take your medications on time every day, especially this one since you have to take it twice a day. Make sure that like if you keep a little pill packet with you, or if you have like a reminder on your phone that that's getting used, just so that we don't suddenly stop it, because it could result in some harder issues to deal with than just blood pressure. And then also that if you notice any swelling while you're taking this, if you're taking it for a long period of time. I don't think it's something we'll run into here in the hospital, but we just don't want you to have any crazy swelling or sudden weight gain from water retention or anything like that. With that, do you have any questions for me about this medication right now? Nope? Okay, awesome. Then here is some water to take your first dose with, and we'll be back to check on you in a little while.